Hello, hi everybody. My name is Krista Harris. You probably have seen me doing these lives for the past couple of weeks because it is May, Mental Health Awareness Month, one of my favorite months. I am coming to you with What's the 411 on Black mental health. So every day this week, I am talking about a different topic and highlighting things that you should know, questions you should ask, tips and resources of different important topics within the Black and Brown mental health arena. Tonight, I have the pleasure of chatting with LaKeetra Josey, who is a psychiatric nurse. I hope I'm saying that right. And I have the honor of asking her questions that a lot of you guys asked me. So I cannot wait for her to join. If you can, please share this live with everyone. At least 5 people will say. At least 5 people now. Share the live at your friends, especially ones that are, talking about mental health or ones that should be talking about mental health. So let's start. Hello.
Hi, how are you?
I am, what, I always like to ask this question too, but today I am tired. I'll say that. I am tired.
Understandable. Yes.
How are you?
I'm hanging in. Feel like most people are sort of in that we're hanging in space. Yeah.
Yeah. And I'm not anxious, but I'm like the world is really opening up really quick, really fast type of thing.
Yep.
I'm like, and I'm trying to move slow, but I feel like everybody else is moving faster than me.
You're like, slow down. Yes.
Yes. Yes. So, like I was saying, this is What's the 411 on Black mental health, a platform that I started to talk about different topics, share different resources and whatnot, especially for this month because it's Mental Health Awareness Month. So I said, why not chat with Dr. LaKeetra Josey, which I met probably like a few months ago. And I'm so excited that we have crossed paths. So, can you do a quick intro?
Sure. So I'm Dr. LaKeetra Josey. I'm a psychiatric mental health nurse practitioner. So to give you a little bit of background on that, so I'm a nurse first, and I wear that proudly. But my specialty is psychiatric and mental health issues, prescribing medication when needed, things like that. Also, behavioral health therapy, counseling.
Okay. And happy Nurses Week as well. I know that was
last
week. Right? Yes.
Thank you.
We're going to highlight that psychiatric part, right? Because that's a very big part, a very big component. So I want to know, and people that are watching, what is the difference between a psychiatrist and a therapist? A lot of people, when they come to see me, which I'm a therapist, and they're like, I can't get medication from you. And I'm like, no, we have to schedule you with a psychiatrist. So can you let people know what the difference is?
Sure. And I think you've actually highlighted it well. So a therapist would tend to be someone that is licensed maybe as a professional counselor, a licensed clinical social worker. My colleagues, please don't hate me if I'm leaving anybody out. But there's a number of different ways to be certified and credentialed as a therapist.
Right.
A psychiatrist, or like myself, a psychiatric nurse practitioner. It's our training and our background allows us to be able to prescribe medication. And so when and where you would see that difference is it's not that like a psychiatrist or a psychiatric nurse practitioner couldn't also do therapy. It's more the flip. It's just that a therapist can't always prescribe medication. And for me, that was actually one of the reasons why I chose to be a psychiatric nurse practitioner, because I wanted to be able to be sort of that one-stop shop for my clients. So if, when meeting with somebody in counseling or therapy, we recognize that there may be a reason that medication might be beneficial, I would be able to intervene in that way and not necessarily have to refer them out to someone else.
Got you. So I feel like a lot of people already talking a lot about mental health, talking about the importance of seeking therapy, talking the importance of seeking just professional help in order to just get your mental health in check, right? So now we're throwing another wrench, right? Now we're saying, well, some people, not all, there may be also another step to take in this whole mental health process, and that is possibly taking medication, right? So now first I done got on board with taking therapy. Now you're telling me medication. So how can someone know when it's time to see a psychiatrist? What are some of the signs and symptoms that you may notice or pick up, or for a person to notice for them to maybe also schedule a session with a psychiatrist?
Sure. So first, one of the things that I would say is maybe we could back up a little bit and maybe reframe how we think about mental health, and put it in the context of wellness, right? And so I would say that anybody could be more or less healthy on any given day. So on any given day, you could be more physically healthy. Just like on any given day, you could be more mentally and emotionally healthy. Your brain is an organ, just like your heart, your lungs, all of those other parts of your body. And sometimes, we need to intervene to help it work either more efficiently or, to work a little bit better, or for it to do the things that we need it to do. I mean, I don't think that we really hold much hostility towards people that use their inhaler for their asthma, right? But by that same token, like if someone needed to take medication to help adjust their mood, or to help regulate their mood, but I guess I'm biased, right? Because I feel like everybody should have someone, and everybody should, be able to, and it's not necessarily the case that everybody needs to take medication, but it is helpful to have a thorough evaluation and to at least be open to the discussion, because otherwise you may be missing out on something that could help facilitate, right? Like help you feel better. When people's lungs are seizing up because they have asthma, they feel better when their airways open up and they use their asthma inhaler, right? I would think of mental health and mental health medications along those same lines, in that we're trying to treat an organ that, for whatever reason, needs some assistance. And that was part of the reason that we started our practice. And so I know I was a little bit brief on my introduction. My husband will get on me all the time for that. But, my husband Lamont and we started Your Center, and it's capital YOUR, lowercase r, Center, LLC. And the reason that we did that and we started it together was because, we both worked in mental health fields, Pennsylvania, New Jersey, Delaware. And we felt like there was a lot that we could be doing to help benefit our community. And so not, that we're going to be it and we're going to do it all. We're going to do the best for everybody forever, but just that we recognize the need and we know what we can do about it. So rather than talk about it or complain about it, we're going to try to be part of the solution. And so one of the things that I think that really helps benefit people when they're considering medication is being able to meet with somebody and have a thorough evaluation where they're actually going to ask questions, get to know you, and be honest with you. For example, if they feel like, maybe what you're dealing with at the moment isn't necessarily something that medication would be of benefit for, and somebody would tell you that. But I also think it's important that we're taking into consideration that our physical health can also impact our mental health. And so if our blood sugars are fluctuating because of diabetes, or if our thyroid is either hyperactive or running really fast and making us feel anxious, or running really slow and making us feel depressed, like those things can impact our mood. And if we're not taking care, and if we're not checking into it and looking into it, we could try treating with medication that isn't going to be effective anyway, because we're going after the wrong thing. So I think a really thorough evaluation is important.
Absolutely. I liked how you broke that down because like I always say that mental health and physical health, I believe they're one and the same. And sometimes people look at them as separate entities, but like you said, it really is a cause and effect sometimes.
Mhm.
Somebody said, I wish medication was not looked at in such a negative way. It's very helpful for those who really need it. People have no problem taking Advil when they have pain.
True.
And
Right.
that's very true. And I think, like I said, it is a negative connotation because people sometimes think like, oh, I'm crazy if I take this
Mhm.
medication, right? And I one of the signs and symptoms that I look at when I'm talking to my clients, I'm all about balance, right? And
Mhm.
so people get anxious here and there. Actually, sometimes we need a little bit of stress in our life, but it's about balance. And so when that scale really starts tipping and it really starts impacting to a point where it's like you can't catch it. You can't, it's moving too fast, almost like if you run it and you really can't catch your breath, kind of using like that
Mhm.
asthma example, then it's like, okay, let's see what they say.
Right.
Excuse me, allergies.
Yep. No worries.
um, and even when I talk to my clients, I say, hey, you have the option to take the medication or not, but at least you can do, like you said, a comprehensive evaluation to see if there is some type of challenges, and there is a possibility that medication can help, you know, bring some of that anxiety, depression, whatever it is, bring that down to a calm base level.
Mhm. And I think you hit it really on the head when you said um, it's really whatever it is that's going on, when it's getting so far out of the range of what you're able to manage, that's when we start seeking help. And if we're seeking help and if we're working with a counselor and we're finding that even though we're doing those things and we're trying to use the tools and the tips that we've learned in counseling and therapy, that we're still not quite where we want to be or where we feel like we need to be, then maybe having a consultation or an assessment, an evaluation would be beneficial. And like I said, just because someone has an appointment doesn't necessarily mean that they walk out with a prescription. Sometimes it's really more just about a conversation. And for me, I feel like sometimes people really just not just need to hear, but like need to hear some things in context, right? Like it's not always the case. Like, why wouldn't people be anxious right now? We've had a year of a pandemic, and now we've gone from being so isolated to things like suddenly being like, all right, we're opening everything back up and go ahead, just go like be around people again when you haven't been around people in a really long time. It would be normal and appropriate to feel anxious about that. I mean, I have a picture. I love the Addams Family, right? So Morticia Addams, she's got a caption under her face, and it says something like, what is normal? Like what's normal to the spider is chaos for the fly. It's like it really just kind of depends on your perspective and how you're looking at it. But when you take a step back and look at it from a bigger picture, um, uh, people have experienced a lot, especially over this past year. People are grieving losses, either personal losses, family losses, employment losses, loss of a feeling of safety, of normalcy, like all of those things that you can't just quite quantify and don't necessarily feel right. Now, I can't promise you that there's a medicine that's going to make all of that feel better, but sometimes some things, like when you find that your mood is so low, or you're having such a hard time concentrating, or you have, no motivation or an inability to experience joy or pleasure or happiness, even in the things that you did at one point, or, you're so anxious that you can't get to sleep at night because the tape is constantly running of all of the things that need to be done the next day, or like even if you don't have you can't focus on getting anything done because your mind is running from thing to thing to thing. Actually sitting down and having a conversation with somebody that is trained to not only listen, but assess and evaluate. And I'm less, I'll be honest, I'm less concerned with what I call it, right? Like, do I have to call it depression? Do I have to call it anxiety? Medications work on different neurotransmitters in our brain. They work on different chemicals in our brain. And so I could call it purple for all I care. But if, medicine X works on purple receptor and that makes somebody's mood feel better, then so be it, whatever I need to call it.
Absolutely. Now let's just say now we have the person they're in the office. Like they at the door, they're in the office, or they're on the doing virtual, doing their teletherapy, right? What are a few important questions to ask? Because I'm all about advocating, speaking, especially in these type of, these rooms with professionals, because, sometimes it can be intimidating. And I get clients, they come back to me, well, what about this? And well, what does this do? And I said, well, did you talk to the psychiatrist? No, I didn't ask. And so sometimes they're intimidated because, they're like, they said I have this, so this is what it is. And they take the medicine and go on about their business, because sometimes that appointment can be very brief. So What are some questions, maybe 5 questions, 3 to 5 questions that they should ask when in talking to a psychiatrist?
I mean, so I'm gonna put the plug in there, psychiatrist or nurse practitioner. Just
thank you.
Because so I would say that I always think that people should ask what the medication is for, right? So what is it that we are trying to treat with this medication? Because like a blanket statement of this is for depression, that's not a sufficient answer. I do have to put the disclaimer out there. I do teach pharmacology and psychopharmacology, so I understand medication to a degree that maybe some people don't, but I also impart that information to the clients that I'm working with. Maybe they get more of a pharmacology lesson than what they want, but they will understand what the medicine's for. But they could also get information as to what it won't help with, right? So it's as much important to understand what it's for as for what it's not for, right? What will it help with? What won't it help with? If there hasn't been any discussion about maybe getting some lab work to see like how your thyroid is and how your cholesterol is, or is there any like electrolyte imbalance, I would tell somebody to ask, is there lab work that should be done first? Or should we, is it something that should be done at the same time? Because some of our medications can impact people's weight and their blood sugar and their cholesterol. And we don't really know how it's impacting them if we don't have a baseline. Now, when I say that, I also have to say to our potential clients, like if those labs are ordered, you have to get them done as soon as possible, because otherwise then we won't have a baseline. And when we're really trying to track someone's health and keep them as healthy as possible, those are just some of the steps. So, checking their thyroid, their cholesterol. I would also recommend asking, how long before I might see an effect, right? Yeah. Because sometimes, right? Sometimes, it like you said, right? It was such a thing to come to therapy in the first place, and now it's like, all right, it's such a thing for me to go and actually have this med appointment, and now like, how long am I going to have to wait for this medicine to work, right? Am I going to take it and it's going to work like tomorrow? I mean, I really think some of my biggest job is to manage people's expectations, is to help them understand that, in the beginning, this is what it might feel like, but, give it a couple more weeks and then you may feel like this. Most medicine isn't an immediate, you don't necessarily see an immediate benefit. We've got some short acting things that are, we say PRN or as needed. Those aren't the meds that work, every day, all the time. And so if we're trying to change, just like managing someone's cholesterol or their blood sugar, if we're trying to manage something consistently over time, it's going to take some time for the body to adjust.
I'm
And
glad you.
um, our brain actually doesn't move as quickly as we would like it to. Like it does a lot of things really quickly, right? Like it regulates our heartbeat, our breathing, and all that stuff like that. It does that automatically. But in terms of, changing the way it's processing brain chemicals, it doesn't quite happen as fast as we would always want. And so sometimes we just need to have a little bit of patience.
I love that you said that because I get people that say, "Oh, it's not working." And I said, "Okay, let's take a second. It's been a week. It's
Yep.
been 2 weeks,
Yes.
and I say, did you ask what the typical time frame is? And again, everybody's different. Did you ask what the typical time frame was? So I might Google. We'll do some research while I'm in session, so I can let them know what a typical average time frame is. But
Mhm.
people sometimes say, listen, well, I'm taking this medication. It should be working,
Right.
but that's not really realistic either.
Right. And sometimes it's like it's our own anxiety, right? Like it's taken us to get to this point to even be okay with taking medicine. And so if we're here, it's like we want to see it doing something sooner rather than later. I'll be honest, and I am honest with clients. I tell them I usually start them at doses that are what we would say is subtherapeutic, meaning I don't expect it to work yet. But the reason I start low is because if I start at a high dose and you start to have side effects, then you're going to stop taking it anyway. And we're not going to have, then we've tossed like a whole med regimen that potentially could have been beneficial. And so, while it may take a little bit longer, I find that people end up feeling better at the other end of it because we've taken the time, we've allowed the body to adjust, we've allowed the brain to adjust. And so it doesn't feel like this, huge shock to the system that I've got something else that, that I'm metabolizing or working through. I think when people get that explanation, they can work with it. I have had probably way too many clients, more than what I would like, come in and say like, no one's ever explained it to me that way before. Like when you say it like that, it makes sense. And I just, I kind of can't even help myself. I just feel like I need to explain stuff. But I think that if people had those conversations up front, we'd probably see a better response to medication, or even a more willingness to take medicine, even among some of our more resistant folks. Like, sometimes kids or adolescents don't necessarily want to, or maybe someone that has a more severe, persistent mental illness, as long as they understand, and people can understand when you speak to them about their, like, I want you to understand what's happening in your body.
Yeah, I think that's important. I mean, walking out of an office and not knowing what not knowing what is going on with you has to be just an anxious feeling as well. Just you went to see a psychiatrist, you have medication, and you're going to go start it, but you don't even know what the side effects are, what the time frame is. You didn't know to ask for blood work, which I'm definitely going to start, recommending and telling people that, because I didn't know that could be something you should talk about with the psychiatrist. So that is definitely something I'm talking to my clients about.
Or even if they've had it done recently with their primary care, we can just sign a release and we can get it so that we have it on file and we don't have to do it again. We just want to have something so that we have a baseline to compare things to, so that if we're seeing changes over time, we know what we can attribute it to and if we need to make any adjustments.
I like that. And I think, like you said something about like not being caught off guard, because, some clients may say, well, I don't have an appetite anymore, or I have headaches, I'm not taking this anymore, or it made me gain weight, I didn't know about it, I'm not taking it. And so I think when people are caught off guard, that also, that just causes more anxiety. And then it could cause them to say, hey, I don't want to go this route anymore, because they didn't know about it ahead of time.
And there are other options too. And the only other thing that I would just sort of put out there, because I think it's important for people to be aware of. I know because we get calls to the office sometimes also for because there's different like genetic tests, right? Like, so you can take a genetic test to see if you're, you know, sensitive to certain foods and all these things like that. And there are some tests that can give some information in terms of how someone might respond to medication. What I think is important for people to understand is that those tests very rarely say, like, this is the medicine this person is supposed to take. And they're not diagnostic in any sort of way. It's not like a dipstick and it's like, oh, look, this person has depression. It doesn't work like that. What it does is it looks at, you know, different genes and how those genes, how people with those genes have responded to different medications. So I mean, it's all statistics and numbers and stuff. And so I use the tests I have, and they are very helpful in terms of adding information and giving information to our clinical picture, but they're very rarely the thing that says this is the medicine a person should be taking. And so I put that out there because I just think it's important for the public to be educated, because things get marketed a certain way. And then someone's like, oh, I need this test to tell me what medicine I should take. And then it's like, we've got to back up and have another conversation, because that's not quite how it works.
Do you ever get questions or people saying, well, I saw this medication on TV. They said it was good for depression. Do you have that? Like, do people come to you and say what they saw on TV, or my friend said they use this for my ADHD. I need this prescription? Like, do you ever get that from people?
I mean, I have no problem with anyone having or advocating on their behalf for their care.
Right.
But I would have a conversation as to say, like, I can't necessarily say what's going on with your friend. Right. However, and if you want a rundown, I can tell you everything about like what this medicine is and what it does. If it is appropriate for that person, we could talk about how and why it is appropriate. But if it's not appropriate, it's not I can't in good conscience just write a script and I'm like, well, since your friend is good on it, here you go. Like,
right. I think I'm glad you did mention that, though, because I think, again, something that I hear being on the therapist end is that, well, I don't want to keep taking these different medications and what have you. But like you said, sometimes you do have to see what is for your body, your blood chemistry, all of that is important when taking medication for it to take effect. Right. So I try to let my clients know ahead of time. I try to let them know all the things you just mentioned ahead of time before walking into the room, so they're not caught off guard.
Yeah. And I think that, even just the idea that someone might end up taking more than one medicine, then people start to get nervous. And I tell you, I promise you, like, we don't work on commission. Like, it's not like I get a bonus if I write like extra prescriptions, but just like some medicine, like drawing to the body again, you might take one medicine to manage your blood pressure. You might take another one to manage your cholesterol. We have different neurotransmitters, so different brain chemicals, right? We've got serotonin, norepinephrine, dopamine. Those all go through different pathways in our brain, and sometimes mood symptoms are tied to different neurotransmitters. And so sometimes we have to use different medications to target different systems and symptoms. And so, it's not like, oh, we just want to pile on because we're not sure what to do, but it's that sometimes more than one medicine is needed just to balance things out.
Okay. Let me ask you this. For people that say that if they take medication, now they feel crazy. Now taking a medication makes them feel, it has some insecurity. They feel, just not feeling like themselves if they take this, right? Or they feel, again, just like with therapy, I should be able to handle this on my own. What do you tell, or what can you tell people that may have to take medication? They may have to make an appointment. What do you say to those people that have that feeling or that thought?
Well, so like I said before, I'm biased, right? So I feel like everybody should have somebody that they get to talk to where it gets to be all about them. And like when you think about us, um, particularly as adults, we're caring for family members, we're caring for friends, some of us may be caring for children, relatives, all of that stuff. And even in our friendships, there's supposed to be some reciprocity, right? Like you talk about your problems, I listen, I talk about my problems, like it's supposed to go back and forth. And I think one of the things that's really beneficial to having a therapist, and perhaps even sometimes taking medication, is having the opportunity to go someplace and let it actually be all about you, because we don't get that really all that often. And making that part of our own self-care, because in order to be that person that we are for everybody else, like we need to do some things to help take care of ourselves. Now, in terms of people feeling crazy or not feeling like themselves and all of that other stuff, I really feel like that comes down to like really open and honest conversations with your prescriber, if you are taking medication, because the reality is, some people, depending on their mood state, maybe they like the way they feel when they're maybe a bit manic because it feels good, right? Like it feels good when their mood is up and everything's wonderful and fabulous until the crash, right? And then that crash makes things really challenging. And then maybe sometimes there's some guilt for some of the things that we did during the time that our mood was up. And so, working with somebody that understands that and really recognizes that, like, we're walking with you. Like, my job is to walk with someone towards their recovery. I provide some guidance. But at the end of the day, a person will choose to take the medicine or not. I can't force them. Like, this is something that you are putting into your body. I'm not putting it into mine. And so having a real frank and honest conversation about how, either the medicine makes you feel or what happens when you take it that would get in the way for you to continue taking it is really important. And actually working with a provider that actually listens to you when you talk about those things, I think is important also. Like, imagine, how many clients have come in and said, I can't take this medicine because it makes me too tired. And someone's like, well, but your mood is stable. And then you're like, but I'm too sleepy and I can't take care of my kids during the day because I'm so tired. Like, this person is going to stop taking their medicine because they're going to prioritize wanting to care for their family, right? So really working with someone and actually talking to them, and not being annoyed by the questions. Like, your evaluations, your assessments and things like that, like when somebody is asking questions, like for me, I ask a ton of questions because I need to understand. And when somebody is maybe feeling a bit more down or depressed or irritable, like it can be annoying. Like, I get it. Like, I understand that all of my questions are probably annoying. You've probably said it to however many people you talked to before, but I don't want to take information from other people. Like, I want to understand what it feels like for you so that we can come to a decision together about what the best path is forward. And it should be a mutual decision. It shouldn't just be like, oh, you came in today, I'm going to write for Prozac and I'll see you in 3 months. Right.
I'm glad you mentioned that. You mentioned a lot of things that we just talked about last week. Again, about asking those questions, your provider not being annoyed when you ask those questions. You are allowed to ask these questions.
Absolutely.
Because this is medication that's going into your body. This whole treatment plan is to help you, regulate your mood and to just live a more healthier, better life. So yeah, you absolutely have the right. So I'm glad you brought that up because we definitely highlighted that last week. So Dr. LaKeetra, I want to just say before we end, is there any other things that maybe just that you want to highlight, a myth that you may hear or know, like that, resides within the medication realm, that you want people to know that is either true or not true?
So one, there is no magic pill that's going to fix it all. Absolutely not.
Glad you said it.
right? Because if there was, I'd be a bajillionaire and like be on some warm island somewhere. So like, so there's that one.
Okay.
There is no magic pill that's going to make your kid like follow your directions. Like we maybe if someone's a little bit impulsive and stuff like that, we may be able to get them to slow down and stop and think. But if they're going to tell you no, they're probably still going to tell you no, right? They might think about it first, but they might still do that. And the third thing I would just say is that it is in no way any sort of personal failing. If there is a need to address your mood or your anxiety with medication, it's not a failure on your part. It doesn't mean that you're not strong enough or any of that stuff. Like none of that is personal. It's biology, it's neurochemistry, it's life, it's epigenetics, it's a whole bunch of stuff that's all coming together to be this picture that is you at this point in time. And so if you need some additional help, I would hope that you would take advantage of the opportunity and reach out and get it and connect with someone that will listen.
I'm so glad you said that. I'm definitely going to be highlighting those things when I post this. I'm so glad you said that. Before we leave, Dr. LaKeetra is on the Black, Brown, Delaware Therapist Directory. Her practice, This Is Your Center, is listed on the directory, in addition to the Phoenix Center.
Yes, so Phoenix Center for Health and Wellness is our drug and alcohol treatment program. So we know that sometimes not only do people struggle with mental health and anxiety issues, but they do struggle with a substance use issue as well. And so we do have another program available to help our clients that are struggling with that as well.
Absolutely. And at This Is Your Center, which is listed on the directory, but
it's just Your Center, actually. The website is This Is Your Center, but our practice name is just Your Center.
Oh, Your Center. Okay. So
yep.
Your Center is listed on the directory, but she has multiple different providers there at that practice. And there's men and women at her practice. So I like to always point that out, especially people that are looking for men therapists, and I point them in your direction. And I can
that. Thank you very much.
Oh, absolutely. Absolutely. Thank you for being on the directory. I appreciate that. I appreciate you and Mr. Lamont for, being a part of this. I'm so grateful for you guys both. And I thank you for doing this live with me to talk about this important topic. How can people reach you, Dr. LaKeetra, if they need to, or the information for your center, which I will also post it in the notes.
So our website is www.thisisyourcenter.com. So that is our outpatient mental health practice. We are for the most part, our appointments are virtual right now. And we also have www.phoenixcenterforhealthandwellness.com. That's our drug and alcohol treatment program. As Krista said, we have a number of therapists, male, female, younger, more seasoned, as my husband likes to say. So people that have been around a little bit longer, or at least walking the earth a little bit longer than, some others. We do have a number of African-American males. We work with people across the lifespan. So children up to adults, older adults, providing psychiatric evaluation, therapy, medication management. We run the gamut.
Awesome. And a few people have reached out to me needing a therapist for children. So I have pointing them in you guys' direction as well. Thank you again. I appreciate you. I'm grateful that you took some time out your schedule to chat with me today, talking about medication and the importance and the different questions to ask. And I will make sure to highlight those in the comment section as well.
Thank you very much. And anytime anybody has any questions, our contact information is on our website. So feel free, clients can always reach out.
Absolutely. So thank you, Dr. LaKeetra, and I'll be right with you behind the scenes.
Gotcha. Okay. All right. Bye. Bye, everybody.
So you guys, I'm so glad you were able to tune in to join us with What's the 411 on Black Mental Health, as I was able to chat with Dr. LaKeetra Josey, and we talked about medication, we talked about the importance, we talked about questions to ask, and I'm going to highlight all of those important things in the notes. Again, you can find me at the Black, Brown, Delaware Therapist Directory if you are looking for a provider. You can also follow us at BBDT_directory, both on Facebook, Instagram, and Twitter. I look forward to chatting with you. Of course, we still have a couple weeks left in May, so I will be chatting with you again next week. And as we wrap up, What's the 411 on Black Mental Health? See you next week.